I am going to start the recording as long as you're kind of ready to go, Dr. Cullen.
Yeah, I am. Is the camera okay? I can never tell. Are we good?
It's good for me unless a TV person wants to chime in, but I think you're framed fine.
Okay.
Hold on a second. I'm going to start the recording. And it has started. So, Dr. Cullen, if you want to kick us off with some opening comments, go away.
Great. First off, thank you guys for joining us in the middle of July. I think we're all hoping for a respite with a large monsoon. At least I'm hoping for that at my house. We want to talk about two things this morning. I'm going to kick it off with COVID. I know it may seem a little boring. I want to remind people we are in a stage of accelerated transmission. The vast majority of our COVID right now is the BA.5 variant. The reason why that is important is, as you will recall, with Omicron, we saw a subsiding of respiratory symptoms with COVID. We are now seeing a resurgence of those symptoms that is due to the variant that we are seeing in the community. We want to remind people that vaccination is your best way to protect yourself. Remember to get your boosters. For many people, they should be up to 2 boosters right now. My recommendation is to mask in public, my recommendation is to mask when you are inside in public situations with people that are not in your social circle, that you do not know their vaccination status of. In addition, we want to remind people that Test to Treat was launched approximately 2.5 weeks ago. This is occurring at our East Public Health Clinic. This includes the ability to call in if you have tested at an outside clinic and or at a home test, be appropriately evaluated for one of the oral or the pill antivirals, and get a prescription for that. You can also come into that clinic and be tested and immediately assessed with a nurse practitioner for whether Paxlovid or another antiviral is appropriate. So we would encourage people to seek testing if they are symptomatic, obviously to stay home if they are symptomatic, and if they are positive, to be evaluated for whether an antiviral is appropriate for them. Let me now turn to monkeypox. We are announcing today our first probable case of monkeypox. This is an individual who is less than 40 years old. They are appropriately isolating. Our epidemiological staff is working closely with this individual. We have done contact tracing. You'll recall that is when we asked the case, what are the potential contacts? We have been in touch with the state, who has been a wonderful partner here, as well as the CDC. We will be receiving vaccine into the county for treatment of the contacts of this case. In addition, Pima County, Maricopa County, and Coconino County will become hubs for distribution of the monkeypox vaccine. We expect that shipment to deliver approximately July 14th. Who is eligible at the current time due to the limited vaccine supply are those who are considered either that are contacts to the case. Epidemiologists, in our case, our Pima County Health Department epidemiologists will be working closely with the case to identify those contacts. We are also in the process of working with the outlying counties, the counties assigned to Pima, Yuma, Cochise, Santa Cruz, Graham, and Greenlee. We will be working closely with their health departments to ensure that we can be the appropriate distribution for vaccine. At the current time, I want to remind people vaccine is very limited. Pima County will be getting 100 vaccines. It is a 2-dose series. Once again, we will be getting that vaccine sometime around July 14th. For those who may consider themselves at risk, we will be setting up on our website a way that you can enroll for when the vaccine becomes available. If you choose to do that, all you include is demographic information, and someone on our staff will call you to assess whether you will be at risk at the time we go to vaccine, which will be preventative. Right now, people who are getting vaccine are under the rubric of PEP. They have post-exposure prophylaxis. People that are known to have been exposed or believe they are very high risk for exposure will be considered for vaccination. And at this point, I think I'll turn it over to you guys for questions. The one other thing I should say is there will be, Anthony, I'm pretty sure I'm right, the county will be doing a press release. There will also be a press release going out in conjunction with the state Department of Health Services. Once again, our testing is done in coordination with the state at the current time. Thanks.
That is both true. Pima County will send out a press release on the monkeypox case right after this press conference, and we know ADHS is also working on a similar one that they'll send out to their groups. So once again, if you want to ask a question, use the raise hands feature, which you can find under reactions at the top. Right now we have 3 people in the queue, starting with Renee Schaefer-Horton, contributing op-ed writer for the Star, and then Benito Kelty is on deck from Tucson Sentinel. So go ahead, Renee.
Hi, Dr. Cullen. Hi. My question is about the monkeypox. You mentioned people can submit information if they think that they might be in a high-risk group. I've been reading some of the reporting out on it, and it seems like, and so this is just confirmation, I don't know if this is true, that the highest risk group is men who have sex with men. Is that correct?
Yes, that is correct. Though it's important to note that not all the cases that are being identified are in that cohort, but men who have sex with men are considered at risk for transmission of monkeypox. Monkeypox is not considered a sexually transmitted disease. The reason for that is that the the most common route of transmission is skin to skin. So if you will recall, if any of you have ever had children that have had chicken pox, that way chicken pox is transmitted is by touching one of the pox. So you can transmit monkeypox by having direct skin-to-skin contact with a lesion. People are infectious until those lesions are 100% scabbed over. And just like with other pox diseases, they tend to do what we call crop. So you can get a few one day, 3 or 4 days, you may get another crop, another high number of poxes. So they all need to scab over. The belief is that in most cases that is 14 to 21 days. But the highest risk group is considered men who have sex with men.
Thank you.
Benito, you are next, followed by Elisa Resnick from KJZZ.
Hi, Dr. Cullen. Thank you for taking our questions. I'm wondering if you could talk about how monkeypox transmits itself, how worried the community should be, maybe give that number or not, if that's applicable here, if you could.
Yeah, these are great questions. Thank you for it. So let me just share with you the way monkeypox is transmitted. Skin to skin contact, so direct contact with a monkeypox rash or scales on the individual's body who has monkeypox. There is a belief that you can also get monkeypox from contact with objects or fabrics. So think of this as an individual who has monkeypox and has slept in sheets, and then you or another contact sleeps under those same sheets and they have not been washed. That does put you at risk. There is a very slight chance of contact with very prolonged respiratory secretions and face-to-face contact. What that means, what most people believe is that means that if you have more than 4 to 6 hours of direct, less than a few feet face-to-face contact with an individual who has monkeypox. The other thing is we do know that monkeypox can be transmitted during intimate sexual contact. However, the vast majority of cases that we are seeing are more likely to be the skin-to-skin contact. As far as should the community be concerned, I think we are always concerned when there is a new infectious disease in the community. However, in the United States up till now, there have been no fatalities. No one has died due to monkeypox. A few people have been admitted to the hospital. They are admitted primarily because of the side effect of the pox. You'll be aware that if you've ever had a skin lesion, you can sometimes get a secondary skin infection. It's not necessarily because of the lesion, but it's because you accidentally rubbed that or irritated that, and then you got transmission of a bacterial infection into your skin. The vast majority of people that are being admitted are because of that latter situation where they've gotten a secondary skin infection. As far as what the community should do, once again, our main goal here is to let people know that we are following this. We do have a robust epidemiological response available, really a lot due to what we learned through COVID. We are working closely with the state and the CDC. However, the odds of an individual in the community getting monkeypox without having direct contact with an individual that have monkeypox are minuscule, and I do not want people to be worried about that. Thanks.
Thanks. We have Lisa or Liza. I'm sorry, it's kind of a new name for me. Resnick from KJAZ, and then Benita is up for a second question. So if you want to also get in line, we have nobody after that right now.
Thank you. And you did get it right the first time. It's Elisa. Great guess the first time. Thank you so much for hosting this. Dr. Cullen, I hope you can talk a little bit more about the current state we're in with COVID infections. It seems like this has kind of taken a turn over the last couple of weeks or maybe even the last month. Can you discuss, I guess, what's different about our COVID spread right now versus, let's say in May or at the end of April?
I think the major difference we are seeing is COVID fatigue. We have done a tremendous amount of communication with our county. We have afforded county residents to have access to testing and vaccination. We continue to have those available at no cost in the county. We now have test to treat available at no cost in the county. However, I do believe that county residents like myself are tired of COVID. The concern I have is what we are hearing, and actually there was a recent comic strip where two people are getting ready to fly somewhere. They both test, they're positive, and they go, we feel fine. We can just go on the airplane. So I think what we're seeing is this inappropriate belief that if I am positive, I can still go and do what I want to do. And so we have subsequent accelerated spread of this. We also know that our ability to track the disease is limited right now because of at-home testing. At-home testing is wonderful. From a public health perspective, we are 100% supportive of this. But there is a responsibility for the person that tests, if they test positive, to follow the appropriate guidance. If you are fully vaccinated, please isolate for 5 days. At the end of that, as you know, the CDC guidance is you can go out, but make sure you wear a mask for another 5 days. So what I think we're seeing right now is just the result of COVID fatigue. We all want this to be over. My staff wants this to be over. I want this to be over. It's not over. And we, as a public health department, want to continue to engage with the community, not scare the community, right? We want the community to understand we are offering everything we can offer to ensure that from a public health and an epidemiological response, the services that you need as an individual, as a family, as a community are available here. But I think the real difference is just fatigue.
Thank
Thanks.
you, Dr. Cullen. I'm so sorry, just to give a quick follow-up to that. I guess at the end of May or beginning of June, there was, I guess the discussion was more about wastewater testing and a ramping up of wastewater testing, working with those UA researchers. Can you share any new details about the county's cooperation with that and sort of where we are now with that process?
Yeah, Pima County is cooperating with the state as well as the CDC. We do have a relationship also with the U of A, but our wastewater data is now on the CDC wastewater site. BioBot is the company that the CDC has contracted with to evaluate the data prior to it being released on the on the CDC website, but we are tracking that routinely. We do see a few ups and downs, really fairly consistent with what we're seeing in the county. So we do believe wastewater is another option for us to be able to assess. Our hope is that wastewater becomes predictive. So if we saw, for instance, a spike in wastewater, we would anticipate that we would see a spike in the county. We are not seeing that kind of pattern yet, but I would say we're in the early stages of evaluating the value of the wastewater surveillance data. Thanks.
Thank you.
Okay, I'm going to jump Benita. I'll go to Nicole Ludden from the Star since she's first question, and then Benita will go to you after that.
Hi, Dr. Cullen. Good to see you.
Hi, Nicole.
I'm wondering if you have any guidance for those who believe they may have been in contact with somebody who contracted the monkeypox virus, or they have contracted it themselves.
So our guidance would be, we hope that you have a PCP and you've reach out to your primary care provider for at least a discussion about whether you are at risk. In addition, our clinic on the north side, our North Pima County Public Health Clinic is available, as are our epidemiologists, to help. We do have information for providers on our monkeypox website, and I'm pretty sure Anthony's going to put that in there, including the phone number for our epidemiologists. We are getting calls in from providers to help assess them whether a person is at risk for monkeypox or not. Let me just talk briefly about testing too. So if someone is considered to be at risk because of the symptoms that they are displaying, there is a protocol for testing that individual. If you test through the county, our tests are then transmitted to Arizona Department of Health Services lab. However, LabCorp and Mayo Clinic are two commercial labs that are able to test. So providers that collect samples, which is basically a swab, are able to submit those to, for most of Pima County, it would be through LabCorp and get a result. The result from LabCorp is approximately 2 to 3 days. The result from the state is approximately 1 day, depending upon if we get the sample up there in the morning. So those who are at risk or are concerned, I would recommend they talk to their primary care provider. And those who believe they may have been exposed should definitely talk to their primary care provider. However, the caveat I would offer is that one of the jobs of our epidemiological service is to identify and then contact the contacts that have been shared with us from the case. Just like we did with COVID, if you will recall, we will be embarking on that same approach. So people who have been named as contacts will get a call from the health department, and they will be asked the similar questions for us to assess their risk. The reason for that is to determine whether they should get vaccinated. Vaccination is ideal within 4 days of contact. We do give the vaccine up to 14 days of contact. It's most effective at preventing the disease if given within that initial 4-day period, however. That's a long answer, Nicole, to your question. I wanted to get that other stuff in. Thanks for letting me do that.
Thank you. I appreciate it.
All right. And for the media in the chat, the link to our monkeypox information page, and that'll have the links for the vaccination interest form and much more information on that. So it's really easy. It's just pima.gov/monkeypox. So we will go to Benito next. After that, there's nobody else in the queue at the moment.
Dr. Cullen, I'm wondering if you could tell me a bit about the health department's concerns with monkeypox, especially considering the relatively low transmission and fatality risk with this virus. Why is it getting this kind of attention as opposed to, the respiratory spread that was happening earlier?
Yeah, such a great question, Benito. I think it's getting the amount of attention because it's unique. We haven't seen monkeypox in the community before. I think by and large, whenever we have a new virus that comes into the community, people are concerned. The good news for Pima County is, once again, because of our lessons learned during the COVID response, we are able to quickly put together a work plan of how we will respond to this. However, one of the roles of public health is to respond to community concerns. I think monkeypox has developed a little mystery around it. So as soon as people hear it, there has been, oh my goodness, what do I do? What does it mean? So one of our goals is to really dispel and to reassure that people that may be at risk, that the health department is there to respond to them. I do want to go to this other question, however. As you know, we just came out of a fairly significant flu season. We're seeing our numbers go back to where they are now. We talked briefly about that. Remember, a lot of that transmission can be halted by a vaccine that is available. Monkeypox vaccine right now, because it is so limited, is only available to those who are contacts. Our hope is that we will get additional supply, and those who are at most at risk, without having been a contact up to that point, will be eligible for it. And Benito, I'm going to take the liberty to also talk about one other thing, which I haven't. You will recall last summer we saw a tremendous increase in West Nile. We have seen West Nile already in the community. We have had one fatality. Not uncommon that we have fatalities of West Nile. Those are primarily in a much older population that tend to be immunocompromised. Once again, we have started doing mosquito trapping. We trap around the areas where we identify cases, and depending upon that trapping, we will decide whether we will do what we call larvicide, which is whether we will prevent and treat mosquitoes so that they die in the areas where we identify them through our trapping. So there's lots of infectious disease going on. I would remind people that the two things that are the highest causes of mortality in the county are heart disease and cancer, what are called non-communicable diseases. And I regret that we haven't spent a lot of time on what we're doing to prevent and hopefully educate people around how they can prevent those diseases. But infectious disease just tends to be what people want to talk about. Thanks.
All right, we got about 5 minutes left, and Renee Schaefer-Horton is back for a second question.
Hi. Going back just a little bit to COVID, with the BA.5 variant being so contagious, I'm reading a lot about reinfection, and basically that, and as somebody who just recently had it, it evades vaccines, it evades the prior immunity. So, as someone who's been vaccinated and had it, as many people are, do we have any protection as far as reinfection? It seemed like it used to be with Alpha variant, you were like safe for like 6 or 7 months. And now there are people who are like, you're not safe for 3 weeks. So I'm just wondering what kind of, I know you're saying everybody should wear masks. And I do notice a little bit increase of mask wearing right now, but not a whole lot. So I don't know, what kind of sort of distance do we have between getting infected and reinfected and reinfected again?
Yeah, once again, this is a really important question. What we are talking about is immune escape. which means even if you have been fully vaccinated and gotten 2 boosters, if you're eligible for that, you still run the risk of getting infected. And you can get infected within a week, 2 weeks, 3 weeks of that second booster. However, what we do know is that your risk of severe disease, hospitalization, and death is significantly decreased. So our message is, please be fully your full primary initial vaccination. Get boosted when you are eligible. Continue to protect yourself. And I think this is a difficult message for people. I've done everything I can do. I've vaccinated. I stayed at home. I still know people that are getting ill when they go out in public. Yes, that is because there is such a large amount of what we would call ubiquitous infection throughout the county. Remember, our our case rates are greater than 200 per 100,000 that we know of. So many of us believe we're probably at 800 to 1,000 cases per 100,000. Still not as high as we were at Omicron, but about 50% of that based on speculative and predictive data. So the major thing I recommend is complete your vaccination series. Get boosted when you're able to do that. And in social situations with people you don't know inside, consider wearing a mask. Remember, the best mask to wear is the one you will wear. Obviously, we believe N95s, KN94s are better than others, but it's really the mask you will wear. And I think BA.5 has just thrown us for a loop. The concern is that we may have another loop pending out there, and so we just need to be cautious. The other thing I would remind people, though, I try to think of what else is positive for masks. If you don't want to get wrinkles, they protect you from wrinkling. They decrease your risk of getting sun damage. They decrease subsequently your risk of getting skin cancer because of the exposure to the sun. And finally, they protect you from other infectious diseases. I wish there was a panacea here about COVID, but there is not. So we just are all on a learning journey with the community, with you, and with each other.
Okay, thank you so much.
All right, we'll sneak in one more question for you, Dr. Cullen. Do you have time?
Yeah, I have one more.
From Elisa Resnick.
Hi, thank you, Dr. Cullen, again. Just a quick follow-up to that last question about reinfection. Is it too early at this time to know, what exactly we mean when we say reinfection? For example, if people, have had COVID this year, or B3 or B1 or 2, based off of what you've seen so far. Because I would agree that's been this huge range of answer of either, you're going to get sick 3 weeks after you've just been sick, or you still have a couple of months. So, are those questions we know the answers to right now, or, is it too early to tell at this time? What exactly we mean when we say reinfection?
Yeah, I think we do know some things. We know reinfection does occur, and that is because of this immunity escape. So even if you have immunity because of a vaccine or a booster, right? We see those people getting infected. We see people who should have immunity. We see people that recently had a COVID infection 6 weeks later saying, oh my goodness, I think I have a sore throat, and let me test, and I'm COVID positive again. Remember, we're not doing viral sequencing on everything, but we do know, at least in Pima County, the sequencing we're doing would reveal that approximately 40 to 50 to 60%, I tell you, it seems to fluctuate every day, is BA4, BA5. BA5 seems to be the more important one, so most of us are defaulting to just talking about BA5. But in the issue, I think that we don't know is, if I get infected and I do okay, I have a cold, I do what I'm supposed to do, it's 2 weeks later, am I at risk to getting reinfected with the same variant? I don't know the answer to that. What we have is anecdotal information that people are reporting that. So I think we're going to have to wait and see. There's a paper that just recently came out at Lancet, and it's a very interesting paper. It looked at people that had the Delta wave. Remember, it was years ago, in 2020, the fall of 2020, when Delta was out, we had just started getting the vaccine. It appears that people that had Delta and a high viral load, the vast majority of people will not know if they had a high viral load. That was something we do with the testing, and we know that for the county-run tests, seem to have persistent immunity if they've gotten immunized and boosted, but nobody knows what that means. And so I think there's so much left for us to learn. I hate to leave this press conference on that note, but it's just important that right now we know how you can protect yourselves from serious disease, and we urge people to do that.
Thank you, Dr. Cullen.
Thanks. We're done?
Okay, that is it. Thanks, everyone. For the media, if you want a recording of this, drop your email in the chat, and we'll get that out to you. Also, look for the press release on the monkeypox case coming very soon.
Thanks, everybody. Have a great day. Appreciate all you do. Thank you.